education. Not to not to say anything else will be added as we move along, but we want to laser focus on those three goals first. Once we get through the door, then we could basically just bring everybody in with other goals and other concerns of the women bleeding disorder community.
So, without further ado, before we get started on some brainstorming, I would like to welcome our speakers. Our first speaker is Sosin Jamaluddin.
Good
Go
morning,
ahead.
everyone.
There you go.
Good morning.
Good morning.
Hi, Sosin. Welcome. And I appreciate you coming on and being willing to share your story about having difficulty accessing care for your bleeding disorder. Would you like to tell us about that?
Yes, so good morning, everyone. My story has been, and I'm sure many of you have had similar stories or faced similar experiences with not being able to get diagnosed and then also not being able to get treatment. And those are, I mean, just two completely different things because I didn't even know I didn't even know I have a family history of hemophilia until I was about 29 years old, when my nephew had it. And I've had symptoms all my life. I mean, you can't, bleeding, joint pain, and my dad died as a, as I guess a byproduct of hemophilia, and it was just really back in that day, no one really talked about it. And I especially come from a culture of silence, so nobody for sure talked about it. But when I found out, I was like, okay, great. I'm going to get diagnosed and I'm going to get treated and all my problems are going to go away. But that didn't happen. What did happen was, and I have Kaiser. I don't know if a lot of, if any members, if any of you have Kaiser, but they don't really want to diagnose females. So, and finding an HTC where I live was like nearly impossible. It wasn't until I actually joined this community and I spoke to Ashley, and she actually recommended or referred me to an HTC or a hemophilia treatment center in Reno, Nevada. And that was when I was first diagnosed. And that was 2 years ago. So you can imagine how long I thought it was in my head for so long. And then realizing that this is something that I've been living with. So I found out I was a carrier, but being a carrier is different almost than actually having someone say, you do have hemophilia, whether mild, moderate, or severe. You do, there is something concrete there, something that we believe you in, not just, So when I went to Kaiser to get diagnosed, and it was a hematologist, she told me that it was just a mystery of life why I was having all these symptoms. And I just thought it was the most absurd thing. Like I just told you, my dad had hemophilia, my nephew severe, I even have the gene mutation. Like you have all this information and you're telling me it's a mystery of life. Like I was really dumbfounded when I left. I was like, what does she mean by mystery of life? Like you have all this information, but you still don't want to diagnose me. And so she really was adamant that if anything, I was just a carrier. There was nothing wrong with me. It was just normal. I think that's what she kept trying to tell me, was that all my feelings, all my symptoms and everything was just normal. Like I should just put up with it. You've been putting up with it for 30 something years. Why can't you just keep putting up with it? Why do we have to actually diagnose you? And that was my biggest thing. Like I was just so frustrated. And I know Ashley, feels the same way. We were just so frustrated. Like, who do we go to that will actually take us seriously? So she recommended Reno and to the hemophilia treatment center there. It was I have the exact, I actually have my diagnosis paper right next to me because I was going to frame it on the wall because I couldn't believe I actually got finally diagnosed. So 2 years ago, I got diagnosed with mild hemophilia. And I went to Kaiser, was like, well, I got a diagnosis. And, what Kaiser wanted to do instead of understanding the diagnosis was they just wanted to give me a hysterectomy. Like, we'll remove all your problems. Here it is. We're going to solve it for you. You don't need anything else. You don't even need to consider anything about hemophilia. We'll just give you a hysterectomy. And that is really so getting diagnosed and getting treated for hemophilia completely two different struggles. So right now I'm still trying to get treated for hemophilia. I've been like chronically anemic since I'll say 25 years. I've been, and it just got worse each time I had a child. My last one was 8 years ago. I have 4 children. So, I mean, I have been getting infused almost weekly. I infused with iron pretty much weekly since then. And they're just, Kaiser just wants to say, you know what, you're just a chronic anemic and we're just going to remove your uterus and solve the problem for you. And so I'm still battling with Kaiser. I'm still trying to figure out where to go, but it's been a struggle. I mean, it's really hard to find someone who will listen to you. It's hard to, especially in the medical field, and especially for women, because hemophilia is considered more of a male's disease, and they don't, unless you're considered a carrier, you have nothing. It's hard to be diagnosed as a female with hemophilia, and that's really the struggle. I think this is the most important thing, is finding more hematologists who will take into consideration that just being a carrier is not always and being symptomatic is not always the thing. You could actually have hemophilia, not just as a carrier, but have it as males do. And that's really what I think the struggle comes from, is the medical field or the medical profession taking it as that it's for both males and females. And that's the struggle right there. So I got the diagnosis, and I'm eternally grateful that I have a diagnosis, that someone has listened to me. But now getting treatment is that's when the battle begins all over again. But if anyone has any questions, I'm more than happy.
So, Sin, I was hoping that you would share. You mentioned that you had to travel to a different treatment center.
Oh.
What state do you live in?
Oh, I'm in California. I traveled maybe 4 or 5 hours just to find the hemophilia treatment center, just to get diagnosed. I had nothing nearby, and Kaiser just refused. And so I got referred to, and I have the name right here. It's the thrombosis center in Nevada, I think. And so it was Nurse Amber actually, and Dr. Yu Chang were the ones who took what I had to say, everything that I have experienced throughout my life, physically and whatnot, and said, you know what, you do have factor VIII deficiency. But there was nowhere nearby me, at least, would they have. I mean, Kaiser is only 5 minutes away from me, and I had to travel more than 4 hours, 5 hours, just to get seen, and just to get heard, and just to get a diagnosis. And that's really troubling when you're, I mean, I've been to third world countries, and I haven't had this experience where you can't even get diagnosed in your home country because they don't take you seriously, especially not as a woman, especially not with a bleeding disorder like hemophilia. You're just considered like it's in your head. And obviously it's not in my head, because I'm going to Kaiser weekly for infusion. So there is something there. I mean, and it's like, okay, you realize that this could be solved if I just get the factor VIII. So Christopher, I'm actually writing my memoir, and that's another story, but it does deal a lot with hemophilia. I'm also a triplet, so there's 2 more of me. We're not really identical, but yes, they also have, one of them is also considered mild hemophiliac, and my other sister has a son who is, he's severe. So he's a severe hemophiliac, and they won't diagnose my 2 sisters. I was like, why don't you just come with me to Reno and we'll go get it? They're like, well, you know what? We shouldn't have to do that. And that is the situation. We shouldn't have to do that. But I was just so frustrated. I was like, I'm going to get a diagnosis because I know this is real. And I know I'm not just a carrier. I mean, and so that's really where the struggle is. Having to travel, like Ashley just reminded me, was really overwhelming, that my 2 sisters did not travel. They did not. Even now, and they're both with Kaiser too. Kaiser will not see them as being hemophiliac. So if there is any time, and one of the biggest moments that I had, that and I didn't even know at the point that I had hemophilia was when I gave birth to my daughter in 2006, it was through an emergency C-section, and I almost bled out, and I was just, and they're like, I mean, they wanted to give me a blood transfusion. I'm like, I don't understand. Like, it was just an overwhelming time during that time. But a doctor came in and asked me, do you have von Willebrand's? And that's another bleeding disorder. And I'm thinking to myself, and I had no idea about hemophilia then even. I didn't know I had a family history of it. And I was like, no, I have nothing. Like, I just kept thinking I have nothing. And this doctor's coming telling me you must have some bleeding disorder if you almost bled out. And since then, I'm going to say it's just, I've just been chronically anemic, just suffering more and more. And my joints hurt. I mean, literally my joint, I'll wake up in the morning, my joints hurt. And whenever I do have a bleed, it's like, where do I go? And so this is really what I'm struggling with right now. And the older you get, the harder it is to keep having to manage it,
If there are any more questions for Sosin, do we have any more questions?
I have a question. So I didn't get if your other two sisters, did they already receive the diagnosis as well, or
They
you are
did
the
not.
only one who?
I'm the only one who went to Reno. They also live next to me. So we live in Northern California. We live in like Modesto, Manteca, California. They refused. Well, they just didn't think that it was right that we had to travel over 4 or 5 hours to get diagnosed. I'm more I'm more of the fighting triplet. So I'm like, I'm going to get diagnosed. I don't care how far I have to travel. So I went and I got diagnosed, but they still today have not got diagnosed, even though we all share the similar characteristics, of it. Thank you, everyone. This is, I mean, for me, especially as a woman, this fight must continue for the next generations, because if we aren't seen or heard, as people in the bleeding community, it's just going to get worse. And having to travel 4 or 5 hours, even if it's 2 hours, when you have a center next to you, a hospital next to you that can diagnose you and can treat you, that should be the first course of action, not them telling you there's nothing wrong with you and we'll just go ahead and do the most invasive thing possible to solve your problem, instead of diagnosing and treating the way that the way that hemophiliac should be treated, pretty much, whether male or female.
Thank you, Sosin, for your incredibly compelling and heartbreaking story. There's some comments for you in the chat.
Thank you.
Kendall Fitzpatrick is our next sharer. Kendall?
Hello.
We're so glad you're here, Kendall, to share your story with undiagnosed bleeding disorder care. Do you want to start off and say who you are and tell us?
Sure. I can't see myself on the screen. I'm not sure if other people can see me.
No, you need to switch the spotlight, Ashley.
There we go. Okay, that's great. So I'm Kendall. I'm close to 50 years old, and I'm also a hemophilia nurse. I would say I do infusion nursing, or at least I started with that. And I also have a child with the same bleeding disorders, plural, as I have. We didn't have a problem getting diagnosis. It's been diagnosed for a while, so we have an unusual combination of factor IX deficiency and also VWD, but type 1. And so I wanted to outline maybe the experience of that. We both had diagnoses for a long time, but when we talk about inequity in care, it is kind of mind-blowing to me how the journey's gone, but also too, I don't think I'm done with the journey, even though it's been this long. So we had diagnosis, let's see, I had my first child in 1994 without a diagnosis, and specifically looking back, I remember after having a C-section with him, holding myself up on the walls, after I brought him home. And all I remember thinking was maybe I was just not eating enough. That's where I left it. And he was diagnosed in 1998. Once he got his diagnosis, in 2 years later, I had an ovarian cyst that had ruptured, and it's a lot of pain pretty quickly when you have that happen. And I had it fixed in the local ER, but for about 4 weeks later, after it had been repaired and I had felt great, I kept having this low-grade fever and also pain at the site where, you know, my left side. And when I finally went to the gynecologist, and I probably went to see a local gynecologist maybe 6 times during that 4 weeks, and I told him that my son had been diagnosed with hemophilia. All of a sudden, the light bulb came on, and he sent me right over across the street to a hospital in Fairfax, Virginia, and I got my own first diagnosis after that with the hemophilia factor 9 and VWD. So it's been that long ago. That was in 1998. I want to say that I've had the diagnosis. The second child I had in 2000, and that was at Georgetown Hospital in DC. And since I had factor 9 deficiency, we had factor on hand. I had another C-section. What I remember about that was that in the whole time of this, VWD was never really an issue. It hadn't been. So factor 9 is where we focused on. And I remember that after I'd had my son, things went okay. But where the epidural was, I had a huge gathering of fluid at the bottom of space of my spinal cord. And that fluid did not go away for probably 8 months. The pain I had, trying to sleep or in positioning, and I'd wake up in pain, and it took 8 months, but I didn't think about it because it was minimalized with my, my condition. So I really didn't think about it. I had plenty on my plate with 2 children. And fast forward to, I lived with anemia for many years, but I also was going to nursing school, and I also worked all the time, and my care would have been last on the list to take care of. And I was always anemic. I don't think I ever had a sweat. I can't ever remember that. And when I would go to the hematologist, now I had moved down to Virginia, down in Richmond area. And that treatment center, those years took care of me and never was suggested get an iron infusion. I was told the entire time, take everything orally. And, I tried to eat the right things for iron, focus on iron. And so that's how I kind of lived over the time period. And I think that it was in, probably in 2015. So that was from 2000 to about 2015. Not many problems during that time, just the anemia, chronic anemia. 2015, I had had a Depo-Provera shot because over that period of time, I would try to take birth control pills or hormone therapy because that was the primary focus for me with the bleeding disorder. And I don't think we talk about that enough. I mean, if you're on these pills to stop your breakthrough bleeding, that's another indication. So during that time, I decided instead of doing the pills, which I would forget them, and then I'd end up having a problem and, periods for 6-7 days. I decided to get Depo-Provera because I had heard about it. So I go and get Depo-Provera. And what no one had told me was that there's a timing with that. So if you go in and get the shot and your uterine lining is full, right before your cycle would begin, which that's where I was, I spun into bleeding for 28 days. And when I saw the treatment center nurses at a camp, I was dropping my kid off at the nurse camp. At the hemophilia camp in Virginia. And I remember saying to them, I know this isn't the proper time to tell you, but something's going on with me that I'm really worried because it's probably day 15 of me and I'm not stopping bleeding. I was so cold in the middle of summer. It's, 90 to 100 degree weather. And I'm in my car with the heat on high and the seat warmers on because I was so cold. And I told them there, and they said, well, it's all right, we'll be here, just make a phone call to the clinic. So I did call them and tell them, and they said, well, keep an eye on your symptoms and let us know how it goes. It was more that when I heard that, I thought, okay, I'm panicking for nothing. Like there's really nothing going on here. So it was finally on day 20, about 28, that I realized that my fingertips were now completely purple, that when I was going up the stairs, I was running out of breath. My muscles in my legs were starting to cramp up. So I said, okay, now I know what to do. Kind of over the years, I figured out that if you can't get in with HTC, if there weren't appointments available, what you would go do is insert yourself through the ER at the HTC where the treatment center was, which was very close to me. So I inserted myself in the ER, and that's when I got the attention I needed. And almost the next day or the day after, I was getting an ablation. But it took that long for anyone to tell me that an ablation was a possibility. And, I'd had 2 children, one with hemophilia and von Willebrand's also, and then the other one with autism. So there was no way I wanted more children anyhow. I wish that had been presented. And once I had that ablation, and it was the most amazing experience, it was kind of life-changing because it was in and out surgery. I had 1 pain pill, that was it. And I expected over the years being used to so much bleeding and wearing black pants. And I thought I'd have a huge, didn't know what to expect, huge amount of blood. No, it was less than a period pad. So it changed my life. And also from that point on, I finally learned what it was like to sweat. I was finally getting hot for the first time in my life that I can remember. So once I had the ablation done, things kind of changed for me and I felt better. And I looked at my own son too. He still has been doing his own journey also. Nothing was ever mentioned for VWD, right? That was the diagnosis, that was type 1. I'm learning more as we're going along because things started kind of changing about VWD, getting awareness, which was new. The NOW conference was going on and I was sent to the NOW conference, and that was the best education I've ever had in my life. And I would give that as a testimony to any patients that I would come across with VWD. But there was nowhere to really get education for VWD. For Factor IX, which was what the whole focus of my care was on, the Coalition for Hemophilia B was there. So there was a group of people to kind of help you with education. And I was treating at that point. I would have Benefix on hand. So Factor IX was on hand for PRN, nothing for VWD. I had Stymate, which was a crappy drug that I hated. Any surgery, so I had 2 surgeries that came up after that period of after my ablation. I had 2 of them, they're pretty major. So for example, for those surgeries, I had Benefix, Factor IX beforehand. I had taken Amicar pills. After post-surgery, I had Factor IX 1 more time again for both of them. And then was told to do Stymate. And in the same sense, it didn't make sense to me as a nurse because Stymate puts you on fluid restrictions, right? That was kind of crazy. And I'm on pain pills for both of these, which makes me constipated. It was terrible, a terrible combination. But I lived through it and it was, awful. My son, kind of same thing, no focus on his VWD also, was all Factor IX. So I didn't see it as anything unusual necessarily. I thought our VWD was just kind of so small, such a small part of this that it really didn't, everything was Factor IX focused. Then flash forward to I put down a year, probably about 2018, and I'd gotten married and I moved into a house with hardwood floors. And I remember, and I'm getting older and I probably added a few pounds on. So that combination and being barefoot all the time, I started first having a joint problem with my ankle. And this is where I'm at now still. This is in 2018 it started. So I had a joint problem with my ankle. I go to the hematologist and I tell them it took a very long time to get attention enough not to see them. I didn't see them. I called them, but they sent me to an orthopedic person. The referred orthopedist came in and they were looking up and Googling Factor IX deficiency and joint issues. And so I knew I was in a bad spot right then. Plus they got me an x-ray where I paid $450 for an x-ray, which I knew was not going to do anything. So I left there just frustrated and thinking maybe again, like it's not bleeding disorder related, because that's what I was told. I was put on Celebrex, the answer was to do Celebrex. And on all my paperwork, after that orthopedic doctor, I look at all my paperwork and what I realized was at the top, my diagnosis, it wasn't the diagnosis that I knew I had was not there. It said symptomatic carrier, or maybe it said carrier of hemophilia, nothing with VWD. So what I learned at that point, because it really upset me, maybe this is why this orthopedic guy didn't believe me. What I learned was you ask the HTC how they report you to the CDC, because that's how they get funding. So I did that, and they told me they reported me as Factor IX deficiency. So that's when I asked for all my paperwork to be changed. So that was a big step in the progress of all my diagnosis. So I asked for another orthopedist, went to him, and he did all of his stuff and suggested me getting that my ligaments were loose and that I needed to get it pinned. And all I could think was, I've got a lot of caregiving responsibilities. My mother had had a stroke. So at this point now, my ankle's getting worse from all the activity. And I can't possibly take off time in the middle of moving, in the middle of taking care of my mother during this time to go get surgery. So I now start wrapping my ankle. And I knew the surgery was there. I just had to wait until it was the right time to get it. So that's where I kind of left off with that orthopedist. In the meantime, I went to PT for probably 6 weeks. I was not getting factor. They would tell me that my factor 9 levels, which were 42 is what I remember during that time, 42, and BWD wasn't even considered. So my factor 9 levels at 42 is where all the boys are put at, right, for their prophy. So this couldn't possibly be related, or it was unlikely, I shouldn't say that, it was unlikely that it was related to a joint bleed. And then all of a sudden in NHF was coming up in 2019. I had just been to a Coalition B hemophilia camp the week before NHF in 2019, and I had been infused. I knew that there were going to be hemophilia treatment center nurses there, and I'm not a great person to stick. So I took my factor with me. I was infused there because I kept having this ankle that hurt. And even there, even at the Coalition camp, it's so funny. I remember feeling better, like nothing hurt on me in 2 hours, just 2 hours after. And I went back to them, and I remember being kind of like, I feel great, kind of excited, and telling them, I had this infusion, and is that possible in 2 hours that I feel better, that nothing hurts on me, that I've been kind of having these aches forever? And I remember even them going, well, it's probably placebo effect. Your levels are high enough for your factor 9 that it's probably a placebo effect. So they said, tell us how you feel the next day. And so I think, okay, so I get through the next day, I felt so good. And at this point, I'm on a Delvion, I'm on a longer acting factor 9. And I felt so great. And the whole time I felt great. And then I had NHF coming up. And I remember being anxious about the travel because it hurts when I travel. NHF, I still felt great. And at NHF, they had a setup of meniscus was there, like from San Diego, I think, California, they had a little booth with meniscus. So I went to them and I said, I've had these ankle problems. Can you please look, and see what you see on imaging for my right ankle is the problem. And he says, well, you're not having an active bleed. And I say, no, I know I'm not, because I was just treated, last week. I just had factor. So I know it's not an active bleed. And so I left. He goes, but you do have tissue there. I can't tell what this is. I can't tell you what this tissue is, but there's an amount of tissue there. And I said, okay, thank you. I felt so grateful. Finally, somebody is telling me that there's something wrong there that they can find imaging on. So I leave, and I remember there's a doctor there at NHF giving the talk on joint issues. It was out from California. She was a doctor in California. I went to her because there was a dinner, like a private dinner, and I said to her, I have levels of like my type 1 VWD, but I also have factor 9, 42. I said, I just got imaging today and kind of confirmation that I keep having these problems. And I think it's bleed related because I had factor and I felt amazing. And she goes, oh yeah, it's probably placebo effect because your levels are too high. So again, I left there and I thought, wait a minute, as a nurse, I know you want to have bilateral comparisons. So I ran back to NHF, the little booth before they closed, right at closing. And I said, please, for me with this meniscus, can you please do my left ankle? So I kind of have a comparison to take forward. So he did the left ankle and he said, yeah, it's completely clean. You can see that you've got full joint, motion. And that was amazing to me because I now had something in my hand to show people that I'd never had before. So going forward, I knew now, and I take care of patients too across the US. I knew now too, like I've got to do something because my care is not what it needs to be. My son also, all this time, like he's also PRN with infusions, and I worried about him. I loved our treatment center. I loved the nurses. There was one particularly who I felt very close to. So I knew I needed to change. So I made an appointment, kind of worried that I would hurt their feelings about transferring care. That was a big deal to me because they knew me and my son and watched me grow up. But I made an appointment to another HTC that was probably an hour and a half away. Went up there. They did my levels again. And all of a sudden, for the first time, she comes back and she says, do you know that when you had that, like your lowest, like in your history, your VWD came back at 13%? And I said, no one ever told me that I was ever that low. No, I didn't understand that. So she said, I bet you that all your stuff has nothing to do with factor 9 because your levels are 40 and above. And all the focus went to VWD. So now what they wanted me to do is every time that I had this continuing joint problem, they would say, do you ever try infusing, now I'm on Von Bindi because I don't need the factor 8. Do you ever try using maybe just the focus on VWD and leave factor 9 completely out to see if this is what your problem is? And every time I would go to infuse, because I didn't do it very often, no, I wasn't going to get stuck and infuse only one product to do an experiment. If I'm going in there in pain when I go in the ER, because it's a lot of volume, when I'm going in the ER and I'm paying $125 for every one of those ER visits, and it's becoming weekly because I'm taking care of my mom. My ankle was not doing well. And so if I'm paying $125 for an ER visit, I'm getting both the factor 9 and also VWD at the same time. And so I did that for a while and it would make me feel better. It would really fix things for probably a good 6-7 days. I would feel amazing. Nothing would hurt. And then it would hurt again with activity. And I went back to the original treatment center just because the other one was far away, went back to them and I'm telling them this and they're sending me again to PT. I'm still on Celebrex, still nothing with VWD is not their focus, even though they got the records from the second HTC. They did change me to having VWD medication in my home so that I could use it if I needed. So I had that accomplishment. But I also realized that this is still not the care that I need. So I was willing to travel and most people can't afford that. They can't afford the time. They can't afford the plane tickets, the gas, whatever it would take to go do this. But I can, and that's what's not fair. I feel like it's not fair to everybody else, but with myself, I knew I was going to do this no matter what it took. I went to Georgetown again, and it was kind of crazy. This was amazing to me. When I had new patients, the original HTC, if I had new patients that needed to be in that HTC, you would call for an appointment and they were booking out 6 months before you were seen. So I thought the same thing would happen with Georgetown. I called them and I thought, it's going to be later. No, I got in within a week. I got into a specialist with ortho who saw me right away. And when I went to go up there to travel, which is about 2 hours away and a lot of traffic, he sees me and does x-rays to start all the way at the beginning. But he also said, I'm so glad that you didn't get surgery. What you had was a sprain, and the sprain keeps rebleeding. So you need to stabilize your foot and you need to be doing whatever you need to take care of your bleeding disorders to get that under control, and it should stop. So now I'm kind of amazed at the difference between the two treatment centers about the ortho results. So then I get seen in hematology probably on week 2 from that first phone call, which was still mind-blowing to me of the difference instead of 6 months. And I get seen there, and it's a Dr. Kupfer who works with Dr. Kessler, and that's actually where I delivered my second child. So I was familiar with Kessler. Kupfer does all my blood work, and he comes back and he's like, your VWD is so low that you need to be on Profeed. So now I'm on Profeed twice a week for VWD. I'm learning how to self-infuse, which is not easy because my veins are really small. And so now I'm in the middle of doing all this, and my ankle, it stops hurting now. So I've been doing it now, and I wake up and I can tell you the difference when I infuse. I can feel it now. I know what to look for, and it's amazing. So with activity, I can still feel I need to infuse again because it will start aching. Even on this, I haven't infused since last Thursday, so I can tell like I need to get on it again because it's starting.
Kendall, I just want to remind you that we did give everybody kind of a time limit, but your story has hit so many points that I'm sure people have never heard before. Some people on this call, some of us know it because we live it. And I really just am shocked at what you have had to go through to get this care to enable you to not have an ankle that hurts.
And on my other joints too, because it's all catching up. I mean, I put on weight, but this is too why I say I don't think the journey is over, because right now with Dr. Kupfer, I'm on twice a week, Trophy, Von Vendy, but my factor 9 now, he says I shouldn't have to use that at all, that my levels are high enough that I don't need factor 9 unless it's surgery related, which I'm gonna say I disagree, because from DNA, I have got 6 other female cousins. They're all at about 35% factor 9, no VWD, and they're all PRN, but they have joint problems as well, and they're only factor 9. So it's still not over. And I'm planning on traveling to whoever the next person is if I have to. And that's it. Sorry, I didn't mean to go over. I just had so many details from the timeline.
It's such an important story. Thank you, Kendall. Next, we have a continuing update from our father, John Martinez. John, will you share what has happened since we last talked to you?
Yeah, just a minor update. We the last time we talked, talked about the issue with my daughter, that both my daughter and my wife are mild hemophilia A. Both my sons are severe A's. But I was with my daughter, and the doctor had said that she was von Willebrand's when there was no variation in her von Willebrand's tests. So when we were at the appointment, I had explained to her that she's actually a mild hemophiliac, and we had a bit of a going back and forth. And she ordered $1,400 worth of blood tests. All the blood tests were based on von Willebrand's. Not one of them was to check her factor 8 level. There was one which was part of the figure, it is linked. So there was one that showed the factor 8 activity. And we're having an appointment actually this morning at 11:30. I'm gonna have to get off the call pretty quick. I gotta go take her to her appointment this morning, because I called and asked, when I saw the web portal saw the results, I asked, why didn't she do a factor 8 level test specifically, since that's what we discussed? And the nurse could not give me an answer. So we're going in just about 45 minutes to go in and talk to the doctor. I'm going to ask her directly why she didn't do that specific blood test. So I will let you know. So, but yeah, and by the way, just to Kendall's and to Sassen's points, I'll tell you, this is an HTC, it's the one here in Madeira, and they are on the NHS list of premier women's support centers in the country. And I can tell you that's not the case. So it's not always, it's not a matter of getting to the right, it's getting to an HTC, it's getting to the right HTC that has a provider that's willing to accept some new information and to get trained on this. So I think this is exactly where we need to be, is educating these providers.
Thank you, John. Does anyone have any questions for John? If not, we're going to move on. Stormy was going to share, and she is traveling and not able to be available, but we've got Janet Harrington Brewer, who is going to share her incredible story next. Thank you so much, John.
Hi, everybody. As I listen to your stories and I reflect on my own, am I muted? Better now? Okay. As I listen to the stories that are shared here, and I reflect on my own story, the thing that continues to overwhelm me is that our stories are all so similar. They all reflect on the fact that, yes, we may get a diagnosis, but how hard you have to fight to get that diagnosis, or how often we are discredited and marginalized and have to spend a ridiculous amount of time trying to get somebody to just listen to us. Or, in some of my experiences as a woman managing healthcare, not just as a woman who lives with a bleeding disorder and a significant family history for bleeding disorders, is how often we're told as women, well, it's all in your head, or you must be depressed, or you're dealing with anxiety. I'm the mom of three children, all of whom are affected by a bleeding disorder. I grew up with a brother with a bleeding disorder. And what just constantly seems to be the theme is that it's all in your head. I don't know, I'm overwhelmed, honestly, from all of your stories, just how emotionally impactful they are. Like many of you, I dealt with anemia my entire life. The best thing I ever did for myself, at the age of 38 was to have a hysterectomy, because I just couldn't manage it anymore. And the thing that I remember being the most significant about that moment in my life was that I could finally wear white pants and not be afraid. And how much I embraced that. I'm like, oh my gosh, I can finally wear white pants. Like, this is just a whole new, fashion lifestyle for me. And I guess, as I'm thinking about, being concise about what my story is and what has driven me as an individual within this community, is that for some of you know me as the founder of Comprehensive Health Education Services, and the passion that I have had in me for a lifetime after my brother was born with hemophilia, and is just continuing to advocate and to fight for others, whether it be you're an individual in the inhibitor community, which has been something that has touched upon on my life personally, whether it's been advocating for people with rare bleeding disorders through a very dear friend who has factor VII deficiency, and the organization that she started that I've been intimately involved with for the last 16 years as someone who worked in a specialty pharmacy after transitioning my career from a special education teacher to working within industry, is the Ladybugs Program. I've met many of you through Ladybugs, and I'm blessed to call you friends and sisters. But the thing that just keeps driving me is this needs to change. This needs to stop. If you were a male with mild hemophilia, you would have factor in your refrigerator by the end of the day, and nobody would be questioning what your levels are, how high your adjustment is. And we need, as Ray said, we need diagnosis, we need treatment, and we need medication. We need for women to stop having to prove that they have a bleed. The stories that I've heard since we started since Comprehensive Health, the CHEST took over Ladybugs in 2016, is so many of you who are saying, I have a piece of paper that says I have a diagnosis, but yet I hear from hundreds of women across the United States that they need to go for imaging in order to prove that they have a bleed. And I'm going to close with this. As the mother of children with a bleeding disorder, I was taught from day one how to recognize a bleed, how to look for those subtle symptoms. Are they limping? Are they cranky? What does their facial pallor look like? Are they pale? I knew how to recognize a bleed before my boys even knew that they had one. So if you trained me, and HTC's trained me, and my physicians trained me so well in terms of recognizing a bleed in my sons, then why is it for those of us that are carriers, that have children with bleeding disorders, can we not recognize a bleed in ourselves? We know what that looks like, and this needs to change.
Very wise words, Janet. Does anyone have any questions for Janet and her commentary? If not, I'm going to move to Ray.
Hello, everybody. Can you hear me?
Yes, we can hear you.
Oh, good, good. Thank you, ladies, for sharing. Really, thank you. A lot of powerful stories. It hits me hard because it's archaic. It's very archaic in treatment. There's men on this call. One good friend of mine has a big platform. Call this the silent crisis in hemophilia now. And he's right. We need to basically build this coalition. We need more voices. We need men voices in this. I mean, we're hearing your stories. We need your stories to get to the Blood Brotherhood, because we're on the sidelines and we have tremendous voices to help you. We want to stand in solidarity, like I've been speaking about. We want all the organizations. Basically, we want to support every initiative they got going. This is what we did during the HIV/AIDS crisis. This community could do it. I've seen who's on this call, men and women. We're a powerful community standing together. When you break us up and segment us, we lose that power. We have fantastic organizations that within themselves have inroads that can move the needle. The 3 points, the diagnosis, the treatment, the medication, that's the laser focus. And if we get all our organizations, our chapters, pharma, especially pharmacy, HFA, NHF, Foundation for Women Bleeding Disorders, CHESS, Coalition for Hemophilia B, moving in that straightforward line, they have to listen. We also need to support the doctors that do support women in their centers all across the country. They have limited voices. They also have financial stuff where they could only go so far. But if we're pushing them, they could reach out to their colleagues, because their colleagues will listen to their colleagues, hopefully. Focusing on the goals, what I'd like to ask this group here, and we're open to any real suggestion that works, any real suggestion, depending on when we use it. But I'd like to ask, focusing on the goals that we laid out, those 3 goals, diagnosis, treatment, and medication. What else ideas can we do? I know we did some, and we do it all along in the community today. I mean, Washington Days, putting women's bleeding disorders at the top of the list and funding for HTCs because they need both. A letter writing campaign where maybe a form letter can be sent out and the community could sign on to it and send it to HRSA, NIH, FDA, CDC. A women's health initiative. Maybe we need something inserted into the Women's Health Initiative bill that deals with women and bleeding disorders exclusively. It's ridiculous that a woman gets a diagnosis and can't get treated. That's archaic. And we've fought. We've had this battle before. And a lot of information is out there on women and bleeding disorders. I like all your stories. It's great, but we need to start telling these stories to the people that have power to basically move the needle. We can't just keep the stories in our community. I'd like to see more education, more of your stories basically given to the Blood Brotherhood, so men could understand what's going on. We have men today, and we lost a whole generation to HIV/AIDS. But we have young men today that are having daughters. I've had several conversations where, the new fathers having daughters and going, what is the treatment for my daughter? I know I'm a hemophiliac. We know there's women not getting care. I'm a bit afraid for my daughter growing up when she hits a menstrual cycle. Men are not afraid to have these conversations. We want to stand in solidarity with women, back you up, and basically get the needle moved forward, because this is a silent crisis in hemophilia. So I'd like to hear from anybody who would like to give a suggestion, what can be done, what are action steps that you feel a community-wide basis can take?
Can I say something?
Will it be in response to the question?
I'm trying to respond.
Sure, if it's in response to Ray's question, please. Thank you.
It is in response to Ray's question. I believe the first place we have to start is with our treatment centers. They don't listen to us. I don't think they even believe us. I am the only one at my treatment center. I'm trying to get as much information as I can to take back to them, but I need help. They are not going to listen to me, period. That's where we should start. That's all.
Thank you, Priscilla. There's a comment in the chat from Darlene. Oh, sorry, is someone talking?
I was.
Go ahead. Thank you.
I mean, those are the people we need to get our voices to, but we need to have a concise coalition throughout the country with all our organizations to basically bring that voice. One big voice. That's how we got movement in HIV and AIDS. One community voice.
I was just going to mention there's a good comment in the chat from Darlene Shelton. She says, in our work, her speaker's not working. She says in her work, and she works with Danny's Dose, which, full disclosure, I am the vice president of the board. I've connected with HRSA and also was able to meet with the director over the Hemophilia Treatment Center a few years back. My opinion is a sign-on letter to ask HTCs be required to launch a women's initiative for proper diagnosis and care. And then we've got another comment from Patrick James Lynch. Do you just want to say it, or are you busy?
I'm happy to say it. Just listening to the suggestions, it seems to me that a well-organized letter writing campaign that captures all these stories in one place would be very powerful and really an irrefutable singular collection of stories and data, soft data. So when Ray talks about one community voice, perhaps could this singular aggregated resource be that thing that our one voice is driving people's attention to, because it so clearly makes the case that this is a crisis in need of crisis level attention.
This is Chris Templin. I would also add that we also need to make our advocacy organizations understand that, look, the system isn't all rosy and perfect, because a few years ago, back at a safety summit, NHF and HFA both refuted what I said when people from HRSA were in the room about there really isn't no problem in the centers and women can get care. So they need to wake up and sort of smell the coffee too and understand that things aren't all rosy in hemophilia treatment center land. And just 2 weeks ago, I was sitting next to the director of blood for CDC, and they agreed. He said they agree with me, that there is a problem, and with the voices of the collective us. So they understand what's going on. It's just we need to start putting people's feet to the fire. And it breaks my heart to hear the women speaking today about their stories. I applaud you for having the courage to do so. I encourage you to do it more. Nothing more is going to change this situation than hearing these stories and making people know that the struggle is real. And I'm in this fight to the end, even though my daughter gets the best care ever. She probably gets better care than I do at 11 years old. So, but it breaks my heart that not everybody gets the wonderful care that she gets. And what even breaks my heart is she goes to the same center that Priscilla goes to. So she's a young girl, gets great care, gets everything given to her, got loads of scripts and whatever. But Priscilla is an older person, not a pediatric patient, and that's where the downfall is. It is just completely ridiculous. So, like Ray said, we need to get the males involved. And this is just ridiculous. This is 2022, for Christ's sakes, and this shouldn't be happening. Thank you.
Thank you. There was another really good comment, all good comments in the chat, but Darlene, who doesn't have a speaker, wanted to follow up with the HRSA comment that that the director is of the opinion that the HTCs are running great, and was shocked when she told her that they are not. And Darlene also comments that one person talking to her will not make a change, but an organized group can. And COT, our blood brothers, taught us that. This is what this is about. I want to recognize that it's 10:26. I want to let everyone go back to their day. We did have a trial that Ray was given the information about from Genentech. We'll share that with everybody. And then next week, we've actually got some education that if you've never seen Amber Federizo, who has a doctorate in nurse practitioning, give the Women in Bleeding Disorders presentation, I guarantee your mind will be blown. So I welcome you all to come and take a look at that, and invite everyone from your HTC. I'm going to do the same thing. We have 5 HTCs in our area, and I'm going to invite all of them to attend. Are there any final comments before we close?
I have a final comment, Ashley. Just a suggestion for everyone who may have a group or chapter in this group, more open conversations in our community for them to share their stories and what kind of help they have received, what not. And so we can later on focus all of that database that we can collect, we can record it in our own, groups, and then put it all together, as Patrick was suggesting before as well. And as we said in the previous meeting, once we reach all of that database and we can share with the media as well, the treatment centers, is when all of this is going to start moving forward. It's my final suggestion. Thank you.
I'd like to thank everybody on the call. The one thing about the trial, and we have it up really quick, the Genentech's trials, the Haven ones with Hemophilia, they were open to women from the beginning. And that basically, I've asked them, was it women didn't volunteer, or did the treatment centers not give you referrals? They just said they don't know which one was which, but it was open to women. And that's kind of, our treatment centers should be like telling women about trials. It's available to them. The fractionators should be,
Move closer, Ray. We can't hear you.
I don't know what part you didn't hear. Well, the Haven studies, we have it, was open to women to do trials. But Genentech, when I talked to them, said they didn't get any referrals from the treatment centers. The women didn't step up. I don't think that's because women didn't step up. I think they just didn't know the information was there. But even the fractionators, when we talk to them about their factor, all their brands of factor, long-lasting, pegulated, keep going down the line, we get it's non-gender specific. Well, great, but have you used it in clinical trials on women? Because the pushback from doctors is, we'll send women in thrombosis. In my 62 years of hemophilia, and I guess 50 of that, over 50 of that was on factor, I've taken almost 200%. I was never thrown in thrombosis. So we need more of the pharma buy-in and forcing them to also do their trials with women, and not just need the whole community into this fight. It is a silent crisis, and action needs to be taken. Working with everybody.
Janet, you had one last comment?
As someone who has continued to be in this fight and knowing how organizational structure works, and as we talk about action items, I love how everyone is here as stakeholders in this initiative. But I am more than happy as an organizational structure that also, focuses on the nonprofit side, because that seems to be the only way that we'll be able to continue to receive any kind of funding to move this forward. I am more than happy and would actually be honored to help provide an organizational system with an existing nonprofit that has been, that is already recognized. And I think that's the other part is, trying to have one organizational structure that can bring all of these powerful voices, because this is about our fight. This is for all women. And I'm so beyond happy that the men are stepping up to this plate, that the time is now. There's a campaign that our nonprofit is writing grants for, as we speak for a national campaign for women called Seen Not Heard, that will launch the initiative that there is indeed hemophilia out there. It's not just hemophilia. And what's the difference in terms of women's symptoms on the hemophilia side versus the hemophilia side? And what is our reality? We've all been, there was someone who expressed this, and I think it was Ashley yesterday, that it feels like we're in an echo chamber. And you know what? It's time for the echo to become a powerful voice. And if there's any way that, I or my organization can help to move this forward with a centralized, place to put all of this information, please, I would be honored to help move this forward with everyone's help, because it takes a village.
With that, we're going to close it. Thank you, everyone. We'll see you July 6th. I look forward to communicating with everybody. Thanks again.
Bye, everyone.
Bye all.
Bye, everyone.